Good afternoon and welcome to this special roundtable during NHS Employers SAS Week in partnership with the BMA. I'm Michelle Pooley, a Programme Manager in the Medical Pay and Workforce team at NHS Employers, and I'm delighted to be introducing today's discussion. We're going to be exploring how NHS trusts are adopting the SAS Six, what this means for doctors, teams and overall workforce outcomes. We'll hear directly from workforce leaders at several trusts who have committed to the SAS Six, and we're going to be diving into the strategies they've used, the impact they've seen, and advice they'd offer others looking to follow their lead. Just a couple of housekeeping rules before we begin. If you have any questions for the panel members, please pop these into the Q&A box, and we'll address these towards the end. And the webinar is being recorded, and a link to the recording will be shared afterwards. We'll also be saving this on our website for you to access at a later date or share with colleagues. The SAS Collective describe themselves as a grassroots campaign founded by a group of SAS doctors who recognised a need for stronger advocacy and support for the SAS workforce. The SAS Six is a call to action which sets out the asks they believe will enhance career development, job security and professional satisfaction for SAS doctors. We're really grateful for you joining us today. Let me hand over to Dr. Zoe Robertson, a member of the SAS Collective, who is going to be facilitating today's session. Thanks, Zoe.
Thank you. So hi, my name is Zoe. I'm a specialty doctor in anaesthetics up at Northumbria Trust, SAS tutor there and also a member of the SAS Collective. And I would like to introduce the rest of our panel today. So we've got Maria Nave, who's a senior medical workforce specialist at Barking, Havering and Redbridge University Hospitals. We've got Simon Rowe, who's the Chief Medical Officer at Sherwood Forest Hospitals. And we've got Susan Elcock, the Medical Director at Nottinghamshire Healthcare. So thank you all for joining me today. And over the next 50 minutes or so, we're going to talk about our SAS Six within our trusts, and then we're going to go to our Q's and A's. So the first part one was about SAS Six in action. So I'm going to ask the first one to you, Maria. So what motivated your trust to adopt the SAS Six and their objectives?
Hi. I think like all trusts, we wanted to adopt the SAS Six because we wanted to improve the career opportunities and retention of our SAS and LED doctors as well within our workforce, which is crucial. We wanted to form a promise to improve the terms and conditions and working lives of SAS doctors, boost morale and well-being. We wanted to demonstrate the value of this part of the workforce, and this can lead to greater job satisfaction and improve morale. I did some work at the time of when the new SAS doctors were introduced to include SAS doctors and LEDs on endlessly renewing their contracts and to transition to SAS contracts. I also started pushing this when the SAS Charter came into effect as well, and we worked with the BMA to go through certain things, and we realised there was a lot of work to be done. It felt with the 6 pledges that the campaign developed was a good structural way to go through them and achieve this in the trust.
Sorry. And when did you start supporting the SAS Six? How long ago was it?
It was, I think it was this time last year we embedded this research campaign, yes.
Yeah. And you've got over a couple of hundreds or so SAS doctors.
We have 134 SAS doctors, including 90, which includes 19 specialist grades.
Brilliant. Excellent. And since over that year, that motivation still there? Are you still finding that the drive is still going?
Yes, I do believe it is. We have a lot of doctors that we include them in a lot of seminars, forums, etc. And I always try to include them all in different meetings and make sure that they know that. I email them maybe every couple of months to ask them how they're getting on with certain things, if they feel they are being motivated or, to move across to different contracts, etc. Do they have educational, timing in their job plans, etc. So with that, I feel that I can share that with the, Director of Workforce and the CMO, and I include all my reports, etc. to all the SAS doctors as well at the forums.
Excellent. Sounds like it's been a good start over the last year with
I
yourself.
think it did. Thank you.
Good. And just to move on to yourself next, Simon, how did you go about embedding this SAS Six objectives into your workforce strategy at Sherwood Forest?
Thanks, Zoe. Afternoon, everyone. Yeah, so just perhaps a little bit of background about Sherwood, just to sort of put that into context, really. So we're a district general hospital serving the sort of middle of Nottinghamshire, so Mansfield and Newark. We've got around just over 800 medics on our books at the moment, 26 specialists, 106 specialty doctors. In terms of our adoption of the SAS Six, so we're perhaps a bit later to the party than others, really. So we signed up sort of January, February time. Part of the reason for delaying that was we, as an organisation, we really wanted to think quite carefully about signing up to SAS Six and be really clear about where we were as an organisation in relation to those 6 main objectives. So before we signed up, we undertook a sort of more formal gap analysis, really. So we took those 6 objectives, we looked at where we were as an organisation and what we thought we would need to do along that journey. We took that through our local negotiating committee, so we had an opportunity for colleagues to look at that. And in terms of embedding it into our workforce strategy, we have a people strategy, which I'm sure most organisations will have. We also have a people committee, so we took it through that governance route. So again, we were sort of quite clear about what signing up meant and how we would, which areas we would need to do more work on, which areas we thought we were already achieving, and that's how we've embedded it within the strategy. So it reports into that committee on a regular basis. So we've sort of been taking updates every few months around the work that we've been doing.
And then does that go down into the business units or the departments? If it was at such a high level, did it filter down, or?
Yeah, so I think through our sort of ongoing conversations, through our workforce team, we're sort of having those conversations at divisional level. So we've set a sort of organisational direction of travel. It's then for that to be how we sort of roll that out across all of the workforce. And I think that's, you know, when we're thinking about workforce strategy at an individual specialty level, that's where we've sort of started to have some of these conversations about how that workforce might develop over time.
Great. And since February time, since you signed up, has that strategy worked, or are we having to adapt it since then? Or
so I think I think we've you know, we've looked at whether there are any sort of quick wins. So I think certainly we've tried to make sure that things like when we're advertising for roles within the organisation, so you know, things that are coming out of my office in terms of trust leadership roles, we've adopted a sort of principle that we've tried to make sure that those are equally available to consultants and to SAS doctors. We have the advantage of having Rob Fleming as part of our workforce, so Rob's very good at sending me an email if actually we send something out that doesn't appropriately reference SAS doctors. So I think we've used that as a you know, perhaps an early win in terms of building something around equal opportunities for experienced doctors to take up those leadership roles within the organisation. I think some of embedding some of the things around educational supervision is something that we've spent a bit more time thinking about, partly because there is inevitably a sort of a time commitment to that, and that needs to be thought through in the sort of the financial implications of that. So those have been that's perhaps been a bit more something that's taken a bit more time to look at. Yeah.
And it's a journey, isn't it? It's recognizing where people are excelling at in certain asks, and in other ones, it's just recognizing of the big development that needs to happen. And that's kind of part of the whole kind of all the 6 objectives, is to get everybody to the good bit at the end, but we're all going to take our own times doing that. And if I'm going to move on to Susan now, thank you. As we're kind of seeing the ones that were easier to do and harder to do, which of the 6 objectives have you found the easiest at Nottingham to embed?
Hi, so thank you for that. So just in terms of a bit like Simon, just in context, we're a combined mental health and physical health trust. Our SAS doctors are fundamentally across our mental health services, so to speak, at the moment. So just in terms of that, and we're obviously much smaller as a mental health, so I've got sort of 120 consultants. So compared to colleagues on the webinar, I'm a lot smaller. In terms of what's been easiest and hardest, I think when Simon talked about sort of strategy, we went very much for values. So if I think about what was easiest for us, we've been doing a lot of work around understanding what different groups of medical colleagues want. So what do consultants want, what resident doctors want, what do SAS doctors want, and doing a lot of listening about that. We've got a programme called Valuing Medical Leadership, and it's got lots of aspects to it, but one of its core to that is how do we support each of the different groups of colleagues with what they want, and understanding and listening. So part of the easiest bit was listening and understanding that actually, I think you said, Zoe, colleagues want a range of things. There isn't, somebody that definitely, this is the direct pathway. It's about having that portfolio of opportunities in clinical and then in the broader sort of education and leadership opportunities. So I think the easiest was also part of the hardest, because translating that into I think looking at some of the Q&As that are coming through, how do we get broader medical colleagues to understand some of the opportunities now? Because historically, for example, chairing meetings, taking on those leadership posts wouldn't have been necessarily routinely open for our colleagues unless it was for that particular group of doctors, in my experience. So we've done, for example, we've opened up appraisal. Other colleagues will perhaps have done this already, but we hadn't got appraisers open for SAS colleagues. Part of the hardest bit of that is then also encouraging people that they'll get enough support and time to feel that they can take that role on as well. So that's a challenge. We've also looked at things like our medical leadership structure and looked at what other trusts have done about, for example, deputy clinical directors being open to SAS doctors. We're not there by any means. And I'm a bit like Simon. I've said, please do email me if I send something out that, I haven't actually thought to make sure it's inclusive. And then our hardest one, which I'm keen to understand from anybody else, is thinking about from an educator point of view, how can you get involved in training for resident doctors more? So that's probably our hardest, that's on the sticky pile at the minute. And
I'll ask that question to Maria. Have you found that at Barking and Havering, the education part of the Six SAS, getting SAS doctors to become educators?
Yeah, we have. We found it hard. It is challenging. We do send them. I actually send a few courses that I've seen from the colleges, etc., for them to join and do it as well. So, but it is challenging getting them to sign up to it. Yes.
I think I'll bring in what we've kind of done at Northumbria season is we had a big drive regionally to train and promote SAS doctors become educational supervisors, clinical supervisors. And it was that regional drive had a massive impact, and it was a big cultural change to kind of show that it wasn't just one department or one trust, it was the whole region needed, well, we all need more educational supervisors anyway for everybody, but it was just that kind of that group hadn't been tapped into, the SAS colleagues. So there was a big drive for us in the Northeast a good 3-4 years ago, and that just changed people's attitude to it all. And now when anybody is newly employed on the SAS contract, our educational department is straight in there emailing and saying, here's your opportunities, here's your, you can be a supervisor, here's the training to go and do it. And that helped when we started the SAS Six over a year ago, because that was already there. So I think it's changing cultures is the hard bit, changing people's, and I don't think people mean, as you say, people don't mean to exclude, but it's if you just open it to all and open it to capabilities, hopefully everybody can apply to all these roles. So yes, it's clear that each trust has their own reason and strategies for the implementation, but we're going to look on now about the ripple effect and what's changed since these objectives have started to take place. So Maria, I'm going to move back to you. So what benefits have you seen for your SAS doctors since you implemented the SAS Six?
I think establishing baseline measures on recruitment, retention, staff morale, different opportunities, and we monitor the progress as such by having these different meetings. We working towards looking at and identifying the LEDs who've been working for 2 years or more, offering them SAS contracts, working earlier careers, etc., with the educational supervision that we've mentioned. And I think this specialist posts that are more recognised as being able to work independently, I think is quite a good benefit for the trust as well. As a clear promotion pathway has created the opportunities for the SAS doctors. I think, yeah, and I think it's more noticeable, as we've just discussed, around the access into educational supervision, particularly for the early career SAS doctors.
And what when you said the first bit was about your LED contracts and the day that's been there for more than 2 years are offered SAS contract, have you noticed that big change, or is it just the fact that you can discuss it openly? And
yeah, I think at the beginning it is just about getting into their department meetings and discussing it with clinical leads, etc., that they can do that. There has been a change, but maybe not as much as we'd like within the year. But we know it's there, and we know it's part of their steering groups, etc., that need to be discussed in detail.
And do you think it's helped both the departments understanding the different roles, but also the individuals understanding?
Both, but we do have, like, I've been at department meetings where it's just clinical leads and we're discussing it with general managers, and also at the same time, at SAS forums, we do discuss it with the SAS tutor, what the different roles are as well.
Excellent, great, that's brilliant. And Simon, I'm just going to move on to you. How have you found recruitment and retention has been affected since the SAS Six have been in place?
So I guess it's probably still a little early days for us, really, in terms of that sort of 6-month period. I think certainly, I think that, as we talked about, that opportunity to open up some of the trust roles across the board, really. I think people have reflected back how they felt that really values the SAS doctor role. So I think that's been positive. I think in the same way that Maria was describing, I think we're just having different and I think more rounded conversations now, particularly in some of our services where we have got fragility associated with the medical workforce. We're starting to have a different conversation about how we can continue to support and grow our own. And I think from Sherwood's perspective, we've had a long history of sort of supporting our own doctors around a CSER route, but I think there's been a shift to sort of to put the specialist doctor role in there as an alternative and equally valid route to developing that workforce. So I think we're having similar conversations about locally employed doctors who've been with us for more than 2 years. Our medical workforce team are involved in those conversations. We're also trying to, in terms of our specialist doctors, they're mainly in emergency medicine and anaesthetics. So we've been having conversations outside of those specialties around how we might develop those roles. So we've been sort of having those conversations around some of our stroke services. So again, I think it's just as part of that rounded discussion about workforce, particularly those areas that are challenging. We've brought this in as a way of having a slightly different conversation to the conversation that we might have had before.
And you said before, I think you've got about 26 specialists in the trust. Have they been people that have progressed from specialty to specialist, or are they people that have been newly appointed as straight to specialists?
Bit of both, but more that have moved through from specialty into specialist roles. Yeah. And
since starting the SAS Six, have you found that if emergency medicine and anaesthetics are finding it easy, is that because they've got a clear progression of that career path, or is it just the numbers are bigger that they need more autonomously working?
I think it is that sort of critical mass, and I think what we're trying to look at from an organisational perspective is how we can provide that sort of support to doctors as they're progressing down this road. But I think in anaesthetics and emergency medicine, because we've got some of those numbers, there's just that better support. People are there to sort of say, well, how did you get on with this, and have those peer-to-peer conversations. So what we've tried to do is sort of think how we can take some of that learning and spread it to the rest of the organisation.
Excellent, that's great. So Susan, I'm going to move on to yourself. Have there been any unexpected outcomes or lessons that you've learned along the way?
Yes, there's been lots. It'd be fair to say. I mean, in a mental health trust as well, a lot of the sorts of things are, first of all, focused and rolled out in acute trusts and in acute specialty sectors. So it's interesting to take what's learned elsewhere into mental health. And just going back to what I was saying before, some of our guidance, so in terms of psychiatry guidance around who can be a clinical supervisor, who can be an educational supervisor, we've been unpicking that, and that's not all necessarily yet sort of fully meeting where we probably need to be able to get to in due course. A lot around not making assumptions, so not assuming that everybody from a consultant perspective knows exactly what the new roles are. So we've done education and work around that to know what you can expect. We've also, I think, learned to allow areas to come up with their own solutions. Once we've educated them about these are the types of doctors now and roles in your area, would it be a specialist post? And we've tried that in sort of older adult recruited in. We've looked also then at the CSER route for some colleagues who are very clear about that, and we've got support in place that that's the route that they want to go through, and what additional support they get. We've had, I suppose, one of the more difficult things, because everyone's painting really positives, there are always difficult things as well, is I've had to be really explicit that if the job that you're currently in needs you to be at a specialty doctor level, we need to look at where are the roles that allow you to then expand and to take on, the next level of responsibility to meet the next criteria. Because I think early on there was a bit of, I need to be able to stay where I am and the job needs to change. And we've had to, I think, balance the needs, of what the clinical services need, and financially where we've got the gaps, and therefore some flexibility in order where we can create and try these posts as well. I mean, most of us will remember the days where you had associate specialists under the previous contracts, and that's how we've been trying to get people to sort of think about how it could work.
Yeah. And geographically, is your trust quite spread out? So that's when people are working, they're working in a certain site and doing a certain job. And if they're going to progress, it might come with, obviously, with the more responsibilities, but that might be a different site geographically. Yes. Is that the bit that is this kind of sticking point with progressing sometimes?
And it's not, I mean, I suppose it's just us all being really clear up front about what can give, what can't give, where the opportunities are, how can we flex that? And that seems to be paying dividends. But because we are smaller, I would say we're able to have all of those individual conversations to see where people want to go. I don't have the mass scale that poor Simon has.
No, I know. And I think that's the thing about all four of our trusts. They're all very different sizes and different geographical areas. We've got district generals, we've got different specialties. But I think the main thing that's been asked about the SAS Six is that individual, making sure that they are progressing their career with all the success that we're trying to do. And it is very individual, because that's what makes SAS careers excellent, is it's an individual career. But when you finally pick all these details, it does come down to some individual things, and in other things it's a cultural change or a department change. But it's kind of a balancing act of knowing which ones you can act on quickly and which ones will just take time. I'm going to move on to the next bit more about sustainability and scaling up or scaling down. Maria, how are you planning to ensure this continuous momentum of the great work that you've done over the last year with everything?
I think just to keep including them in forums, trust meetings, LNC, there's always an agenda that it's always part of the agenda that we include in that. SAS forums report to LNC, so I always do an update on that as well, asking for them to be included on trust workforce boards, strategy boards, etc. As I said, I do keep emailing the same questions to different SAS doctors, etc., just to see the differences, if they're including in any meetings, ward rounds, etc. Obviously, we meet with the SAS Six committee every 2 months and complete a data sheet compiling the set questions. From that, I also do email the medical director and the SAS tutor, etc., showing the differences of the reports. I think, again, maintaining active communication between differences, different campaigns, etc., highlighting the successes, obviously implementation such as the SAS week. We're doing a conference. We've split 2 days. We're doing that conference. And it's one thing that we should maybe do every 6 months rather than every year, I think, to keep communication and engagement, which I think is key. I think my last bit, what I was going to say was, I think we talked about this, is about the culture shift. It does take time, but I think the positive momentum to improve what we are doing, they feel that their concerns are being held and boosting their morale.
And have you found, since you've implemented, who are the people that are coming to you saying, oh, we now do the SAS Six? Is it SAS doctors themselves, or is it clinical leads from the departments or HR? Who surprised you the most that's come forward? And
it's more managers, to be honest. Yeah, it's more managers that come forward and saying, what's SAS Six, what's this campaign, etc., that they come in. So it's just really enforcing what we were currently trying to do. That's what I've been trying to say, and it's more recognised nationally with different trusts and different colleges as well. So yeah. And
when a new manager is having an induction or training, are you implementing the SAS Six within that, so that
we do?
Yeah,
we do. We do an SAS induction every month to SAS. So we do inform them that we're involved in the SAS Six now, and it's more recognised, etc. But we do enforce it more at the forums, to be fair, that we meet them every month. Yeah.
Excellent. That's great. Thank you, Maria. Simon, what internal or external support has been most effective when it's come to implementing the SAS Six?
Thanks. So I think for me, there's a number of things really. I think having people who are passionate advocates for SAS Six and stroke being a critical friend, so that the email to me saying, why did you put that job out and not, could that have been appropriate for a SAS doctor? I think that's something that's really helpful. I think the other key bits for me, our medical workforce team have been really key in this, in terms of picking this up, running with it, having those conversations on the grounds with doctors at different stages of their career, as we've talked about earlier on. I think I agree, it does take a while to change culture. So I think having some sort of formal reporting structure always helps sort of focus people's minds on, we've set some principles out, but actually there's some actions here, and having people held to account over the delivery of those. So I think that structure through our people committee has been really useful. I think there's still a lot of work to do. Your question about what happens when a new specialty general manager comes in, do we have that conversation? Well, I'm not sure I could give you the assurance this afternoon that we're doing that. So I think and that's the value of events like this and being part of the SAS Six, that actually just hear about what other people are doing and sort of take people's ideas away. So I think it is about sort of it is a journey, and it is about taking people on that journey with you. I think certainly some of the workforce challenges that we have at the moment, particularly with the sort of financial challenges that the NHS are in, I think means that we have to look at doing things in a different way. And I think some of our specialties that we've struggled to recruit in, for those of you that know Mansfield, it's not on the coast. It doesn't necessarily have some of the attractions that other places have to work. So I think it's very much around how we keep people here, how we provide them with a career path for the future that meets what the organisation needs, but also meets their career aspirations as well.
Excellent. And was there any key stakeholders in the trust that have surprised you, that they've taken it all on board and have driven the kind of SAS Six?
I think we've had really good buy-in from our sort of senior clinical leaders, so particularly our clinical chairs, who have taken this on board and are part of those conversations with heads of service around, well, have we thought about doing this in a slightly different way? So I think that's been really key for us in terms of making sure they're bought into this.
Excellent. And Susan, what advice would you give other trusts that are thinking about either looking at what they provide for their SAS doctors or thinking about joining the SAS Six kind of support? What advice would you give now that you've supported and embedded in yourself?
very similar, I suppose, to what colleagues have said, but this the power of listening to SAS doctors as individuals, but then as a group, and putting it all together. Because I think some of my experience has been just having those overt conversations that we're not trying to say everybody should go this route or everybody should go that route. We've listened to everybody and we want to provide that individualized. So I think there's something, because particularly putting it into the context of, you know, we're in a position where we've been trying to grow our SAS doctors. Historically, we had a lot of consultants and a lot of trainee resident doctor posts. You know, that was where the trust really had its, you know, services. We're in a different space now, so valuing SAS doctors as a group and having an identity for them whilst acknowledging the individual has also been really important in our trust, to give them that presence as a specific group. So I would say listen, and I think, you know, what Simon said about having your key allies, you know, our SAS tutor, for example, really helps support us and other colleagues as well. But then from an external, you know, having people like Lily, who I know, you know, but I think Simon used the word critical friend, you know, challenging but being friendly and helpful with it as well. You know, that helps us.
Yeah, and I think it was similar to us in Northumbria. The main bit for the drive was I wanted to make sure that every SAS doctor in every department had the same opportunity, because I knew that some were doing not better, but some were excelling more than others, and that implementing the SAS Six kind of had that overriding whole trust, let's target this all together. And it's brought up all the departments that may not have had those opportunities but now are. And I think that's a bit that I would say about for trusts that are thinking about doing it, is it's because it's a trust endorsement, you know, that everybody's hopefully going to get the same opportunity and development that they should all be getting. And that's what I've kind of seen at Northumbria, is that it's bringing everybody together and everybody's kind of shouting from the same kind of positive kind of outlooks and stuff. Maria, was there anything that you would say to other trusts that are thinking about taking on the SAS Six?
I think to begin with, I think you know, as I said earlier, I think it's because it's in their terms and conditions. I think it's something that we need to be doing anyway. Not all they've signed up to it. There's, you know, there's lots of people within the trusts, for example, that think this is like an internal, maybe a SAS Six campaign, but it's, you know, to be recognised as the fact that these are terms and conditions of SAS doctors and things that we should be doing anyway.
Yeah, I totally agree. And I think it's just highlighting that unfortunately some things have been left behind, and actually it's just bringing everybody back onto the same page and just kind of progressing everybody in the way and giving them the opportunities that they should all be given. And I think that you're quite right. It is kind of these basic kind of needs that actually we should all be having. And some departments or some trusts are doing really well, and some just need that extra support and that extra kind of insight to kind of help get everybody to the best place that they want to be as a doctor, really. I think we're going to move on to some questions that are coming from the Q&A box. I'm going to hopefully get Michelle to help us with this. Let me just have a... Okay, I've got a question here. How to start the conversation for a specialist post? How would you initiate that conversation, somebody's asking? I'm going to ask anybody who wants to, Maria or Simon or Susan, who would suggest?
Yeah, I think start the conversation. I think just generally telling them that you know, they are posts there are specific guidelines how to be a specialist grade. It is more about funding, I guess, whether you can change or make someone a specialist grade to begin with. We've looked at consultant posts that haven't been recruited to, for example, and converted them to specialist grades, and then to be able to move into that criteria.
Yeah, Simon?
Yeah, similar for us really. So I think we've often started the conversation in some of those more challenged specialties where we've perhaps, you know, had consultant posts, we've not been able to recruit to it. So we've sort of, that's then led into a conversation about, well, we can't, can't keep doing the same thing and expecting a different result. So what opportunities are there? And that's been quite a useful conversation to have with colleagues, and often at head of service level in terms of thinking about perhaps doing something differently.
Susan, have you got any tips on how specialist doctors can approach?
Well, I mean, my experience is if you don't ask, you don't get, because nobody knows what you actually want to talk about. So one of the things I've learned through my career in particular in terms of developing other colleagues and so on, because I've done a lot of medical education, if you don't ask, people won't necessarily assume, or they might not have that in their brain. So if you want to do it, I've had experience where colleagues have come and said, and I've had a blunt, in that role, that's not going to change, but we can look at these other roles, and we have had people sort of move across. So I would say to anybody that wants to put your head above the parapet and talk, people will receive that so well.
Yeah, and I think for some people, if you explain that if there's capabilities that have to be met to become a specialist, and each of the colleges have put those out with what is expected within that role. And I think if you can evidence that you're either already doing that or working towards that, it's a much easier conversation to have with clinical leads or business unit directors or whoever that you may be approaching. And I think you going with that evidence is much easier than, as you say, people expecting people to expect that you're thinking the same as what you're thinking. It can be a slow process. I think that's the main thing. Unless a new specialist post has been advertised, that depends on what the clinical service requires within that department. But if it's you that already work in that department and you want to drive it forward, I think these conversations at job planning, appraisals, having a mentor to kind of discuss how you can progress those career do make it easier, but you need to have those conversations regularly and often with the correct people. And I think that's probably what we're all kind of saying, that it's not can happen quickly, but hopefully the department should drive that person to progress to that senior role. Simon.
Yeah, just to follow up on that, I think that's something that we did, and again, that was actually led by our medical workforce team. So they have sort of had those conversations with our SAS doctors to sort of look at people's careers intentions and have a conversation around that career development, which we've not always been able to respond to those for some of the reasons that we've talked about, but at least it's helpful to have the conversation to understand where people want to be in the future.
Yeah, great, thank you. So I've got another question here. How do the various national organisations have contributed practically to the SAS Six campaign beyond statements of support? So I think there's about 12 national organisations that have supported or endorsed the SAS Six. Have you found that has helped at trust level, or have you noticed within some specialties, or what are your thoughts on that?
Can I say?
Yeah, Maria, yeah.
I think for me it has, because I know that LAMPS, the National Association of Medical Personal Specialists, have endorsed on it recently. I think back in May when we went to the Royal College of Anaesthetists, I think that shared a little bit of a momentum with our with my NHS colleagues anyway. So I had a few questions based on that, part of NAMPS, etc. So I think that helped within medical HR colleagues, yes.
Simon or Susan, have you noticed any of the national endorsements?
I guess we know they're there. For me, the passion internally has come from us rather than who's endorsed it, if I'm being very blunt. Not that we're not really grateful, and that's great, but that's not the driver.
Yeah, no.
Yeah, it's true.
Simon?
Yeah, I mean, I think it's helpful to have it there, isn't it? If you get people questioning why you're going down that road, then I think it's helpful. But I agree with Sue. For us, it's been people internally who have pushed it, not people sort of coming and saying, well, this particular specialist society has endorsed it. But I think that's helpful in terms of creating that collective culture moving forward.
Yeah, and I think obviously I'm part of Anaesthetics, the Royal College, and the Association of both endorse, and I think it's helped with communication, and it has helped with showing that evidence of wanting to progress, especially people that want to become specialists. That there's certain pockets that those national kind of endorsements have helped with, but it kind of needs to be, the momentum has to keep going to ensure that all specialties and we're all seeing from the same thing. But I totally agree that working at trust level, the trust support is really important as well. Perfect, thank you. I've got another question here. What advice can you give SAS doctors keen to take on more leadership roles?
I feel like you always start, Maria. I feel like we should rotate.
I'm going to give that to you, Susan, actually, because I'm going to give that to you. So let's go for it.
As a psychiatrist, I should be able to sit with the silence better there, and I just leapt in. I think it's a bit of what we were just saying before, you know, about if you're interested, go and talk to people. If you want to get more involved, if you see opportunities, because that's the other thing. The older I get, the more I keep having these moments where I think, well, I didn't think of that, or you know, I wouldn't have thought of it in that way or seen it that way. And so just think about it that way, and everybody wants to help. There's very few people either in medical leadership or medical workforce, medical education, who are not there to support and develop colleagues. And I think get away from the mindset that we're all too busy or whatever that people always say to you when they talk to you. That's what we're here for. And that's actually why we do our jobs most of the time, because we enjoy doing that, developing and opening opportunities.
And do you have programs of leadership programs? Because some trusts have that if you're a new consultant or a senior clinician, you start that kind of leadership journey. Are they open to your SAS doctors as well?
Yeah, so as I said at the beginning, we've got a program at the moment called Valuing Medical Leadership, which is part of our total. So we've done different parts before, we've brought it all together, and SAS doctors and in fact resident ST5s to 6s as well are also open to all the opportunities as well. So also trying to mingle people together in that training. Yeah,
excellent, great. Simon, what would you say for people's opportunities to become leaders or managers?
I think I'd agree with Sue. I mean, I think I'd say go for it and go and have those conversations. I think you might be surprised that people will bite your hand off because it's not always that there's lots of people. Certainly some of the roles that I put out, I don't have people queuing up, banging on my door around it. So actually finding someone who's interested to take that on. I think, you know, there is that bit of nervousness, isn't there, about, well, have I got the you know, that sort of imposter syndrome? Have I got the skills to be able to do it? You know, will I get pushback if I put myself forward? And I think that's where perhaps some of the leadership development offers that you were just talking about might well help people. And we've certainly done a similar thing around where we have a sort of series of programs for emerging medical leaders. And again, we've made those open across our consultant and SAS workforce. So again, I think some of those programs will sort of give you that bit of insight into how you are, you know, that sort of additional leadership skill set. But I think it's going and having the conversation.
Yeah, and I think that imposter syndrome is real, and we all feel it sometimes. And I think having that support or coaching or mentoring from a colleague that can see that you've got the capabilities, but you might not jump yourself, but a colleague supporting you through it can have a massive impact on people applying or getting the progression they need to do those roles. And I think sometimes somebody has to take the leap first to show that SAS colleagues can do these roles. And it's quite hard doing the leap, but if that person's visible in these meetings and at that high trust level, it does make a massive change. Because I think before Susan was saying, you don't mind when people email you and say, can you please change the wording? And I think if you're not in the meetings or receiving the emails, it's hard to know what ones you're missing. So I think it's really important to start getting people in those roles to kind of pick up on those changes. And I think that was the thing at Northumbria. That's what I did. I kind of jumped on a trust role, and I kind of knew I was capable, but I was also taking on that nobody from a SAS role has done that before. So it came with this a little bit of an extra bit of pressure, but it's paying off. And I think it's just showing that you can, but you do need that support through it as well. So I don't know if Maria, have you noticed anybody taking on some new roles at your trust?
Well, There are some current new roles, but what I was going to say was just get them to ask as well as what we were saying. It's a cultural change. They just need to ask. And, you know, if they see a post that just specifically says consultant, go in and ask and say, you know, can I do this? Or, you know, any reason why I can't do this.
And have you noticed anybody over the last year that has taken on any of these roles, or?
Yeah, we have. We've got some SAS doctors that are currently AMDs and leadership roles within our trust. So yeah, there are a few, but not as many as we'd hoped. But you know, it's an improvement.
Oh, definitely. Right, I've got another question here. So what does it look like in trust to have success with the SAS Six? Because we're all very successful since we've all implemented. Right, what do you feel your success would look like now, or in 5-10 years time? What would be what you're all aiming for? Simon.
I think for me, and I'm not saying we've got a lot of work to do to get to this point, but I think for me, that equity of access to roles, and there's quite a lot of comments in the questions around, well, how do you get consultant leaders to accept people taking on, SAS doctors taking on these roles? So I think for me, from a medical leadership perspective, it's creating that culture of equity, and I think the key bits for me in that are setting the principles out, that's the right thing to do. But as you were talking about, Zoe, I think then it's actually having role models and leaders within organisations. So I think once you start getting that critical mass of people who step forward, then people can see what success looks like at that sort of level. I think for us, from a clinical perspective, again, I think it's, you know, as I've described, I think we sort of historically we've perhaps thought about specialist roles when we've not been able to recruit into consultant roles. So I guess thinking about how that might be different in the future, and how there might be more equivalents around that. And again, I think particularly thinking about the ability to bring people through who've been in the organisation for a number of years, and to offer them appropriate career progression, and that they can see a valued career in the organisation is where I'd want to get to.
Maria, where do you see success or your vision?
Yeah, I mean, for us, I'm not saying we're doing very well as a trust, but we are getting there, and I think it's still early stages, to be honest. But I'd like to see more numbers in you know, moving SAS doctors into specialist grades, and those LEDs moving them into SAS doctors as a, you know, looking at it as a medical workforce kind of situation.
And you don't have a target, or you don't have, we must have this certain amount, or is it just that
we haven't, but I think it's worth looking into in saying that we want to do this. Yeah, we want to do this. Like, I know that working again with the SAS Six, my vision is like making sure that we improve the numbers by the end of the year, that we've been doing we've started up with the SAS campaign, but that's my vision. So.
Yeah, no, great. And Susan?
So I think for me, it's we're also, anybody that's listening, don't think we've got this cracked. You know, we're all on the journey in that sense. But you know, it's having an organisation where everybody, including not just doctors, but you know, all of our broader MDT colleagues, understands the benefits of what you know, the SAS colleagues bring, what the roles are, what the opportunities are. So we're not just about educating and getting medical colleagues on board, we're looking at the broader. So that to me would be a big win. And I think the equity says we're not talking about the exception. So I talked about, you know, one appraiser that's come for, you know, one SAS doctor who's come forward to be an appraiser. You know, we would like that we weren't having to cite one as an example of great.
Yeah,
I think that's the board. And I take your challenge, not meant as a challenge, but I think it's a good one about, you know, have we got targets? Not great target driven, but it's certainly a better way for us to think about a change to, you know, in a year, 2 years, what does that look like?
And I think I totally agree. We're all in different journeys wherever our trusts, our departments are. But I think with these implementations, it's good to look at where you are, where you're going, where you see success, but then keep going with that. I think there won't be an end point. I think it'll be a constant thing. And I think that's what you're saying before at the start, Simon, that you wanted to, before you endorsed, you wanted to see where you were as a trust, to see where you had to pull the extra support or the kind of knowledge, so that when you started the whole process, you were on a roll rather than thinking your head, but maybe not. And I think that's the main thing about it, is your success is your trust. We can't, as we sometimes can compare, but I think the key bit is how well your SAS doctors are doing in your trust, in your specialties, in your department. And I think that's the key bit, is for those individuals to succeed. I'm going to ask a couple more questions. What time? So one is, how can smaller trusts with limited budgets or no formal SAS lead posts realistically deliver on all the SAS Six asks? I think that's coming to probably me and you, Susan, because we are the smaller of the two trusts. I think so. None of the asks are driven by finance. Does that make sense? Because as we were saying before, that these are all terms and conditions that should be embedded in these clinical roles, these jobs. I think if you're a small trust, I think what we were saying before is seeing where you are, pick one of the SAS Six and see, are you succeeding, or what would you need to succeed in that? So, for example, that one of the SAS Six is all early career SAS doctors should have access to an educational supervisor. So I think you need to find, who are your early SAS doctors? Are they already getting that? And who are they getting it by? So it's starting off with each of the asks and seeing what opportunities are there. And I think, Susan, you probably would feel the same, that you need to kind of pick one at a time, see where you are, and kind of see where you can go with them. Is that what you would kind of say?
Absolutely. I mean, I'm mindful that there are some trusts, whilst I'm, ours is smallish and growing, there are some trusts that have very few numbers of SAS colleagues. So I guess there's almost a sort of an education and what is the benefit of introducing SAS colleagues as that workforce in the trusts, to think about, if you can see avenues in, and then, as you say, small numbers, think about what's the most likely. And I know this is going to sound awful. Well, it might not sound awful, I don't mean that in that sense, but if you're trying to get something, you've got to think, what's the hook? So what's in it? What's the sell? So that there's something, there's benefit for everybody to then join behind. And I think that's a good way to think about it, because there's loads of benefits and hooks to this.
Oh, definitely. And I think we could go into each of the asks and see completely what the benefit is to the individual, to the department, to the trust, to the clinical, the patients. All of it comes with a positive than anything else. And I think that's the key bit. Nobody's going to lose out if you endorse them. It's just you need that support and that momentum and that guidance to make sure that you're doing it all right, because the whole point is you need to make sure that you have the resources and the knowledge and the understanding of it all to then progress it well. And I think that's a key. Nobody's going to lose out at all. So I don't know if I've got time for one more question. There's quite a lot of questions here, which is excellent. Okay, I'll ask this one. So because I know Maria and myself, and there's a few other trusts that have got together over a couple of months to kind of talk about the SAS Six and how we're embedding it. And do you find that useful, that you can have those conversations? Do you think that'd be beneficial to have more of those, to have networks, so that we can learn and progress our trust as we would like? Or what would you kind of think?
I personally say yes, because obviously since we've been having these conversations, I just go away and speak to the SAS tutor, the medical director, etc., and speaking at the different forums. So a definite yes from me.
Yeah. Susan and Simon?
I was nodding because we have a quite an active group regionally of SAS doctors who do an annual conference, and it would be fair to say the medical directors always get an invite. This year, it did feel like we were slightly bidding between trusts as to who was doing the best and offering the most. It was a great Q&A session, so I think absolutely sharing it was really helpful.
Great. And Simon?
Yeah, I agree. Although I feel slightly embarrassed that I always struggle to get to the meetings because I seem to clash with something else. But I guess that's where having the team around you to be able to go. I mean, I think sharing these things, having an opportunity to share the challenges, and people have shared some of the challenges in the questions this afternoon. I think that's a really good opportunity to sort of bring some of those back to the group and understand what people have done with it. So I think the networking is really important, because otherwise it can feel a bit like you going at this on your own, and it feels quite hard at times. But I think that opportunity to reflect that back to others is always valuable. And we talked quite a lot about culture this afternoon, and changing culture, as we said, takes a long time and it can be hard. So actually having an opportunity to reflect that to other people, I think continues to give you the impetus to do that.
Great, thank you. And I think we're in our own trust and our own little bubbles of what we think is working, and I find it really fascinating and interesting to find out what goes on in different trusts, and just even the sizes and the geographical nature of all our trusts are so different. And I think we do have to use and learn from each other, or even just have an open, I think the fact that it's open conversations and that we're being very open about things that we want to improve is a massive improvement for all our SAS doctors. So thank you. So I'm going to close today. So we've covered quite a lot of real stories, practical strategies and thoughtful reflections. Thank you to our panelists for sharing your experiences, and it's clear that SAS Six is helping to shape the culture and development and support of the SAS doctors across all organisations. We hope today's roundtable has been inspiring to others to support their SAS workforce, and we'd be grateful if you could complete some feedback for us on today's session. Our evaluation for today's event will appear on your screen shortly. And thank you for joining us this evening, and we hope you enjoy the rest of the SAS Week. And don't forget to use hashtag SAS Week 25 in your social media posts. So thank you all, and enjoy the rest of your evening.